Compared to a year ago, when we had our first big outbreak, we are in a much better position today. We have built up our testing and contact tracing capabilities. Crucially, our vaccination program is well advanced. With stronger defenses in place, we've not had to impose a full circuit breaker. Unfortunately, we are also fighting new, more infectious variants of the COVID-19 virus. The B.1.1.7 variant, which was first detected in the UK, has become widespread in the US and many other countries. We are now dealing with a B.1.617.2 variant, which was first detected in India and is now in over 50 countries. More variants will inevitably emerge, and we'll have to deal with them too. What does a more infectious virus mean for our fight against COVID-19? It implies that we must continually adjust our strategies and raise our game to keep COVID-19 under control. Specifically, there are three things that we have to do more of and do faster: testing, contact tracing, and vaccination. Let me briefly explain. The multi-ministry task force will provide details later on. First, we must test faster and more liberally and extensively. This will enable us to detect COVID-19 cases more quickly so that we can isolate them and ring-fence their contacts promptly before the virus spreads further. Many different types of COVID-19 tests have become available. For example, antigen rapid tests, ART, saliva tests, breathalyzers, wastewater surveillance, even sniffer dogs. We've been using some of these and evaluating others for some time. Each of these new tests is suited to different use cases. For example, antigen rapid tests, ARTs, produce results much faster than the PCR tests, the polymerase chain reaction tests that we have mostly relied on. ARTs are also cheaper and easier to administer. However, they are less sensitive than PCR tests and may miss some cases that are actually COVID-19 positive. ARTs are therefore invaluable as a quick check. If you visit a GP or polyclinic now with an acute respiratory infection, you will be given an ART in addition to a PCR test. Within 30 minutes, the ART will show whether you are likely to have COVID-19. If the result is positive, you can immediately be isolated. And the PCR test will confirm your diagnosis later, which may take a day or two. That way, we reduce your chances of infecting others if you're already ill but don't realize it. Other tests are coming on stream. Breathalyzer tests, which take just 1 minute, have been set up at the Causeway and the airport. They can be deployed to many other places too. And soon you'll be able to purchase DIY tests over the counter at pharmacies. They are simple to use and not so uncomfortable. You can administer these on your own. If you are worried that you may have COVID-19 and want to put your mind at ease, or if you are a frontline worker and want to test yourself frequently, or even daily. These alternatives to PCR tests help us detect and isolate persons quickly when they are most infectious. This will be a big help in slowing down the spread of COVID-19. As the virus mutates to become more transmissible, we must respond by testing more widely. We already do rostered routine testing, RRTs, in a number of higher risk settings. Migrant worker dormitories, construction work sites, shipyards, air and sea ports, hospitals, and nursing homes. With faster, cheaper tests, we can do routine testing at more workplaces, like offices, restaurants, and shopping malls. We can also routinely test individuals whose occupations involve close contact with many people and could result in super spreading events, like taxi drivers and bus captains, physiotherapists and masseurs, stage performers, sports and fitness instructors, and educators. All could be tested regularly. This will reassure their customers, patients, and students and enable them to work safely even with COVID-19 in circulation. In short, we are shifting our approach to testing. Henceforth, we will not only test to identify infections when a new case pops up. We will also routinely and regularly test people who appear well in normal work or social or community settings to make them and these places safe. Extensive testing will give us confidence to resume larger scale events or gatherings. For example, we can deploy fast and easy tests before a religious service, a football game, a concert, or a wedding reception. And participants can be assured that the event is COVID-19 safe. Therefore, you should expect routine, large-scale, fast and simple testing to be part of our new normal.